everyone, and welcome to this Psoriasis Awareness Session. I'm Dr. Anushka Amlani from Integrated Health and Wellbeing Council. This interaction with top dermatologists from the length and breadth of India is aimed to spread awareness about psoriasis. Today, on account of World Psoriasis Day, we will be talking to Dr. Sandipan Dhar, Professor and Head, Department of Pediatric Dermatology, Institute of Child Health, Kolkata. Welcome, sir.
Thank you very much, Dr. Anushka.
As we go ahead, I'd like to set the context for the discussion. Psoriasis as a disease is just not skin deep, a disease that affects approximately 10 million people in India. It is also not fully understood. With the launch of Live Life Limitless, an awareness campaign, we aim to make an impact on the awareness of psoriasis, right from the basic do's and don'ts to the advancement in therapies. Once again, I would like to welcome Dr. Sandipan Dhar to share his valuable insights with us today. Moving on, sir, my first question to you is if you could help the audience understand what is psoriasis and how does it impact the patient's life?
Psoriasis is one of the chronic diseases, chronic inflammatory diseases, which gives rise to, very unsightly skin lesions in the form of red patches or plaques on which there are scales. And whenever the patient usually gets up from the bed, they complain that the bed cover or bed sheet is full of scales. Their scalp is full of scales. It sometimes leads to a lot of itching. Most important thing is that the disfigurement in terms of social stigma. People having psoriasis, they, have always felt that they are ashamed of themselves. Their quality of life goes down. Their self-esteem goes down. Their career building for younger, people, children and adolescents for their, studies, everything goes for a toss. And people, by and large, have got the perception, very unfortunate though, even in 2024, that something which is visible on skin has to be infectious. They don't understand that 99.9% of the things which appear on skin are not infectious. On the contrary, there are many things which are not visible, are infectious. Like a person sitting to you next in the cinema hall and watching the movie, and inhaling and exhaling Mycobacterium tuberculosis, and you are inhaling that and you develop pulmonary coughs. And the person absolutely looks hale and hearty. This is the example I give to my patients. Whenever they talk about psoriasis and the stigma, I tell them, look, this is the kind of picture one should know and one should propagate on a very important day like Psoriasis Day, because psoriasis, as you rightly pointed out, it brings down the quality of life. And there is a huge number of people of psoriasis in India now. Gradually, it is increasing. It is all over the world. But in India also, it is, its percentage has increased over the last 10, 15 years. And this is one of the few diseases where people, after suffering for some time, they develop suicidal ideation. That is absolutely something very, very sorry state of affair. And there are instances where people have committed suicide with psoriasis. So this is the disease which it looks benign, physically, but psychologically it is malignant.
Thank you, sir, for helping us understand the impact on patients' life, both on their mental and physical well-being. Moving on, my next question is regarding the chronicity and the long-term complications that psoriasis brings.
Chronicity of psoriasis means psoriasis, once it happens, invariably the patient and the party, they go to the Google and they search. And first line, they see that psoriasis is not curable. That's something which puts them totally off. And when they come to me asking the same question, I ask them another question. I tell them that I am answering you in terms of asking a question. You tell me one single disease which is not of infection's origin. It is not an infection, but is completely curable by medical treatment. Is hypertension curable? Is diabetes curable? Is thyroid disease curable? Is neurological problem curable? is, urological problem curable? Nothing. The cure term has become more or less obsolete. Nowadays, we are talking in terms of good control of the disease and maintenance of quality of life of the patient. That is very important. So this is the very important thing which we must convey to the patients, that this is a chronic disease. You have to be, this is how I tell or counsel the patients, and in case of children, the parents on the very first day. They be ready for a long drawn battle, but don't ever feel frustrated because some of your friends and neighbors say that is not curable. Remember that they might be having a chronic nephritis, which is also not curable. They might be having diabetes, which is not curable. Only unfortunate thing which has happened with you, you have developed a disease which is visible to the external world. So that's why you are unfortunate, but you are much fortunate than many others that your kidney, liver, lung, everything is quite okay after investigations we see. So you must look at the positive angle of it rather than looking at the negative angle. This is in terms of chronicity of the disease and bringing down the quality of life of the patient with psoriasis.
Thank you so much, sir, for showing a different perspective of looking at the disease. Moving on, what are the treatment options that are available for the patients and how can we manage the disease?
So I started my dermatology career way back in 1989 in PGI Chandigarh. So we had only very limited options like topical Coulter or solar and ultraviolet light, not even light. We used to call Puvasol, solar light, I mean exposure to sunlight. That time all this narrowband chamber or ultraviolet light has not come in the market. I'm talking about 1989. So we used to, and maximum mid percentage topical steroid, right? Those days. And yes, one medicine was there, which is still quite pertinent in the treatment of psoriasis. That was methotrexate. So these are the only options we had. But over a period of time, we have seen for acute flare of psoriasis, we are having a molecule, very good molecule, cyclosporine, to control the acute flare. We have got a very good molecule. It's a very old molecule, but still it is, as it is called, old wine in new bottle. Over a period of time, methotrexate has proved the test of time. It has passed the test of time. And it has shown that for long-term management of psoriasis, methotrexate is really unparalleled. But it has got limitations. For all the immunosuppressive therapy, people have used other immunosuppressive therapies also, mycophenolate mofetil, and many other things, azathioprine, hydroxyurea, but they have limitations in the sense that they are immunosuppressive, first most important thing. So you need to regularly check the immunological profile of the patient, hematological and biochemical parameters of the patients every 3 to 4 weeks. And many times you might have to stop. Moreover, they have got some adverse effects, sometimes very serious, on liver, kidney, and lung. So there lies their limitations. Third, there is an unmet need of a percentage of psoriasis patients which must be as high as 35 to 40%. Even with repeated courses of all these immunosuppressive, cyclosporine, methotrexate, another, is retinoids, oral retinoids. This group of patients cannot be nicely controlled and maintained on a clear skin or near clear skin for long-term purpose. And those who have got other comorbidities, I'm sure we'll be talking about that, like obesity, hypertension, hyperlipidemia. Nowadays, we are talking in terms of that. Whenever a psoriasis patient comes, first exclude the metabolic syndrome in that patient, because we know a significant percentage of patients of psoriasis have got other comorbidities in terms of metabolic compromise. So whenever the person has a metabolic compromise, suppose the patient is obese, has hyperlipidemia, has diabetes, then you have to be extra careful in giving this immunosuppressive therapy.
So, what about biologics and how does biologics help live life limitless?
So this is a very important question you have asked. Over last few years, we have seen molecules like biologics, which has really changed the our entire concept of treating psoriasis and given the patients the quality of life they could never imagine. I have number of patients who had never seen their skin clear over last 6 to 10 years. With use of biologics, their skin has cleared within 3 to 4 months and some 5 months, and they're so happy. There are young adults, there are working people, senior people. They used to have a lot of social stigma. Let me give you some example, you will understand. I have seen few patients who came to me with just few lesions over the dorsum of the hands and wrist, and they said that, doctor, this is not going with your current treatment. Can you give something else? I then suggested them biologics. And though this is costly, I found them, they accepted it. Then it cleared. Then it was my query that they are not getting the reimbursement and this is such a costly molecule. So why they are interested just to clear few patches, 5, 6 patches on the dorsum of the hands? Then this is not one, 3, 4 persons, they said, doctor, I'm a bank officer. Whenever I give the currency to my customer, they always look back at my hands, and we have seen the kind of repulsive attitude from them. I think this is a very sublime social stigma, a torture, mental torture a patient of psoriasis has to undergo in our so-called civilized society of 2024. Biology has changed that. That is the beauty of biology.
Thank you so much, sir, for highlighting the importance and the impact of biologics in the treatment of psoriasis. We all discussed about other treatment options as well. So, how does biologics stand when it comes to those options?
See, basically, biologics cannot be compared with any other sort of treatment, whether it is TNF alpha inhibitors, which we used to have 10, 12 years ago, like infliximab, then etanercept, then came adalimumab. And, off late, we have got two beautiful molecules, secukinumab and isecukinumab. Particularly, I have got a lot of experience of giving secukinumab. And I find the patients who are not being controlled with earlier treatment and even earlier TNF blockers, when I put them on secukinumab, and they got very good result. This has happened with at least 20, 25 patients over the last few years. I must say the number is not less. And, they are in fact very happy. In fact, very happy. And their quality of life has totally changed to the extent that they could not believe that this can happen with a medicine. And then my job becomes easy for counseling them, making them understand, because this group of patients, they have been suffering for such a long period of time. All these patients, 20, 25 patients, they were suffering for at least 10 to 12 years. And the kind amount of reading they have done, they are all educated people. The amount of reading they have done, they can ask any questions and take any dermatologist for a task. So asking so difficult questions at times. So they know what is what. And by the time they get the good response, they are very much convinced. So our job becomes very easy.
Thank you so much, sir, for your valuable insights. As we conclude this session, what is the importance of regular doctor consultations and the therapy adherence to live life limitless for psoriasis patients?
My advice to all the psoriasis patients who are suffering from it, uh, I must tell them that have confidence in yourself. Don't go by what, your neighbors and, your friends say or give free advice. Don't accept anything free. Everything comes at a cost. So advice also should come at a cost. And second thing is that must know what is happening currently in this medical scenario, particularly in the scenario of psoriasis therapeutic armamentarium. The biologics have really changed the concept of treatment of psoriasis and given a new horizon to the kind of uh, belief and faith and looking forward to a good quality life for the patients who are suffering from it. And it can completely clear your psoriasis lesions within few months. And if you maintain it as per your doctor's advice, then probably for next 15, 20 years, or as long as you continue, your skin will remain clear. But you should be regularly in touch with your doctor. Follow up as per your doctor's advice. And all the advices, apart from treatment of psoriasis, other advices regarding metabolic syndrome I mentioned, there are some dietary habits, regular exercise, and all these things you have to do. If you have got comorbidities like diabetes, you have comorbidities like obesity, you have to reduce weight, you have to regularly take diabetic medicines, because we have seen if the diabetes is not well controlled, then the person of psoriasis is also not well controlled, whatever best possible treatment you give. So all the comorbidities need to be properly addressed and treated. So then you will be absolutely psoriasis free. You will have a psoriasis free skin, and that's for sure. Which even 5, 6 years ago we could not have told you with so much of confidence, which now we can tell.
Thank you so much for your valuable insights today, sir. Thank you for your time.
Thank you.